How do you correctly measure a tuberculin skin test? Imagine you've just had a tiny amount of purified protein derivative injected just under your skin on your inner forearm. Now, the key to getting accurate results is what happens next. To correctly measure a tuberculin skin test, or Mantoux test, a trained healthcare professional needs to examine the site between 48 and 72 hours after the injection. This timing is crucial because measuring too early or too late can lead to incorrect results. If the reading happens after 72 hours, the test might need to be redone unless a significant induration of at least 10 millimeters was documented within 7 days. When the healthcare worker checks the test site, they look for what's called an induration. This is the firm, raised, hardened swelling that appears at the injection site. It's important to note that redness or erythema around the area is not measured or considered in the test result. The focus is solely on the induration. Using a ruler, the healthcare worker measures the diameter of this swelling in millimeters, always perpendicular to the long axis of the forearm. They record this exact measurement, not just whether it's positive or negative. If there's no swelling or induration at all, it's recorded as 0 millimeters. Only trained healthcare professionals should perform this measurement. Proper training ensures consistency and accuracy, which are vital for correct interpretation. Patients or family members should not attempt to measure or record the results because improper technique can lead to misinterpretation. The size of the induration helps determine whether the test is positive or negative, based on specific cutoff points that depend on individual risk factors. For example, an induration of 5 millimeters or more might be considered positive for people with high risk, such as those living with HIV or recent TB contacts. A 10 millimeter induration is often positive for moderate risk groups, and 15 millimeters or more might be considered positive in people with no known risk factors. Getting this measurement right is essential for diagnosing latent tuberculosis infection. It guides healthcare providers in deciding whether further testing or treatment is needed. Standardized procedures and proper training are the backbone of reliable results. Remember, if you're ever unsure about your test or its interpretation, it's always best to consult a healthcare professional. They can ensure the measurement is accurate and provide personalized advice based on your health history.